Okay, so this is chapter 21. We're going to talk about blood vessels and circulation, and this is for general anatomy and physiology. So first we'll take a look at the anatomy of blood vessels, and we have to look at the structure of vessel walls. So as you know, we have both arteries and veins, and as you will remember, arteries carry blood away from the heart, so A for away. They carry blood away from the heart. So it doesn't really matter if they have oxygenated or deoxygenated blood. If they are carrying blood away from the heart, they are called arteries. Veins, on the other hand, they carry blood towards the heart. So any blood vessels that are carrying blood back towards the heart, those are called veins. Now, typically, when we're talking about arteries, the systemic arteries, those are the arteries that are carrying blood to your tissues. Those are going to be red because they're carrying oxygen to your tissues, from your heart to your tissues. On the other hand, we have some pulmonary arteries, like the pulmonary trunk and the pulmonary arteries, and they actually have deoxygenated blood because they're carrying blood away from the heart but to the lungs so that they can pick up oxygen. So the systemic arteries, they end at these capillaries, and then the capillaries are going to merge together again to form systemic veins. So when the veins are returning from your body tissues, they're returning blood that is deoxygenated, that those vessels have already dropped off the blood, and so they're returning back towards the heart, and they will have deoxygenated blood. On the other hand, when we're looking at the lungs, the veins returning back to the heart from the lungs, those are pulmonary veins, and they're going to be oxygenated. So let's just take a quick little picture of the heart here and let's see. So here's your heart, there's the right side of the heart, and here's the left side of the heart. So the right side of the heart, any of the veins that are coming back to the right side of the heart from your tissues, that blood's going to be deoxygenated because it's coming back to the heart, and then it's going to go to the lungs where it will be able to pick up oxygen, right? So those veins are going to be blue. So the systemic veins are blue. And then we see these pulmonary arteries, which are carrying the blood to the lungs. The pulmonary arteries are going to be blue. Now at the lungs, the blood vessels pick up oxygen, and so they're going to return that blood to the left side of the heart through the pulmonary veins. Because again, veins bring blood back to the heart, but now these veins have oxygen, and then the heart will pump that blood out through systemic arteries. And the systemic arteries then are going to have oxygen. So anything coming from the lungs will have oxygen, and ultimately anything that's going to go to the lungs will not have oxygen. So let's just take a look at these blood vessel walls and see the different layers of the blood vessel walls. The walls of arteries and veins contain 3 distinct layers. There is the tunica intima, the tunica media, and the tunica externa. So both arteries and veins are going to contain these different layers. The tunica intima is the innermost layer of the blood vessel, which I've shown in green here, and it contains an endothelial lining. So an endothelium, which is a type of epithelium that we talked about. And it also has some elastic fibers in it as well to help it to maintain flexibility. The tunica media is the middle layer. It contains smooth muscles, and also it contains a lot of elastic fibers. And when these smooth muscles contract, so when we see these smooth muscles contract, it's going to decrease the diameter. It's going to make that diameter smaller, and we call that vasoconstriction. And when that when the smooth muscles relax, then the lumen diameter will increase and the lumen will get bigger when those muscles relax, and we call that vasodilation. The outermost layer of the blood vessel is called the tunica externa, and this forms a sheath of connective tissues around the blood vessel. It has collagen fibers in it that intertwine with those of the tissues surrounding the blood vessel, and that'll help to kind of stabilize the blood vessel to the surroundings. So your blood vessels aren't just moving all over the place, they're kind of anchored down to the tissues surrounding the arteries and the veins. Now, there are some differences between arteries and veins, so we're going to look at those next. In general, the arteries of the artery vessel walls are going to be thicker, and so they need to be thicker because it's the arteries that are receiving blood directly from the heart. So when the heart beats, that blood is going directly out into the arteries. So the arterial pressure is going to be a lot greater there. So those vessel walls have to be thicker in order to survive that pressure coming at them. And then the veins, the walls are going to be thinner because there's not going to be as much pressure. There's going to be less pressure because by the time the blood flows through the arteries, through the capillaries, and then into the veins, the pressure has really subsided by that point. Another thing that we see is that when arteries are cut, so when they're sectioned, they are able to pretty much keep their shape. And again, this goes to the fact that those vessel walls are thicker. But when veins are cut, they collapse, which is why sometimes when people are drawing blood in veins, the veins collapse because the walls are so thin. Also in arteries, the endothelial lining looks a little rippled. So on the inside, we might see more of a rippled appearance on the inside of that blood vessel lining, whereas in the veins, it's not going to fold. And that's because when those muscles of the tunica media contract, the endothelial lining in the arteries are able to ripple and kind of fold in, and we don't see that in the veins. The other thing is that veins contain valves. We're going to look at those later, but the valves in veins prevent backflow of blood. In the arteries, there are no valves. There really isn't a need for valves in the arteries because there's more pressure in the arteries, and that pressure from the heart beating pushes that blood forward. But by the time it gets to the veins again, we don't have as much pressure, and so we need these valves in order to prevent the blood from trying to flow backward because there's just not enough pressure to push it forward. So there are different types of arteries and veins, so we're going to look at those. So this is a picture of your heart here, and the arteries that are leaving your heart are the aorta and the pulmonary trunk. Those are called elastic arteries. Those are your largest arteries that you have. They're very resilient vessels. They have large diameters up to 2.5 centimeters, not 1.5, 2.5 centimeters. And so when the heart beats, it really pushes that blood out into those arteries. Those arteries have to have a lot of elastic fibers in order to support all that pressure pushing up against the walls. They have to be able to expand and then kind of come back to their normal diameter. The tunica media doesn't have a lot of smooth muscle. Again, it has mostly elastic fibers. It's the heart that's pushing the blood through these large vessels, so they really don't need smooth muscles to contract to try to push the blood further. And again, the examples of these elastic arteries are the aorta and the pulmonary trunk. These blood vessels then are going to branch into smaller arteries, and the smaller arteries we call muscular arteries. And we give names to these muscular arteries like the brachial artery, the axillary artery, the femoral artery. All of these arteries have names to them. They're medium-sized arteries, and they are going to send blood to the skeletal muscles and to all of the internal organs. The tunica media in these blood vessels contains a lot more smooth muscle than it does elastic fibers. Then those muscular arteries divide, and as they divide, they become smaller, and those smaller blood vessels are called arterioles. Arterioles are smaller than the muscular arteries. They have about 1 to 3 layers of smooth muscle cells, and they have poor or even no tunica externa, so all you really see on the outside of these blood vessels is that smooth muscle. These arterioles play an important role in blood pressure regulation. So we will end up calling these the resistance vessels. There's so many of them that when the smooth muscle of the tunica media contracts, they can really change the blood pressure in the body. Now these are about 30 micrometers. They're pretty, very, very small versus 4 millimeters of what we saw in the muscular arteries. So we're getting smaller and smaller blood vessels. Then these arterioles, they branch off too, and then they form the capillaries. So the capillaries are the only blood vessels that permit the exchange between the blood and the surrounding interstitial fluid. So what that means is all of these other vessels like the elastic arteries and the muscular arteries and the arterioles, all they are transport vessels. They can't, nothing can get in or out of those blood vessels. But when you get to the capillaries, now those walls are so thin and it's really just an endothelial layer and nothing else, no smooth muscle, no tunica externa. It's just the endothelium, and they're very thin, like 8 micrometers thick. So anything like water and ions and small solutes, anything that's like lipid soluble, these things are going to be able to leave the capillary and enter into the interstitial fluid. But these are the only blood vessels where that can happen. It can't happen anywhere else. It can't happen in any other arteries or even any other veins. And so we also see that oxygen leaves here too. So oxygen's going to leave, and at the same time, carbon dioxide is going to enter those capillaries. So we see a change in the color. Now we go from red, which is the color of blood as it's oxygenated, and then those capillaries lose the oxygen, and then the blood becomes a darker red, or we kind of give it a bluish color. That means that it no longer has that oxygen, and it's even picked up carbon dioxide, and it's going to deliver this blood back to the heart. So the blood keeps flowing forward, right? So we call this the blood flow, as blood flows back towards the heart. And we can see that it's a continuous loop. So the blood from the capillaries will merge, all those capillaries merge into another blood vessel that we call the venules. So capillaries flow into venules. Now the venules are just collecting blood from these capillaries, and actually we don't have singular capillaries. We're going to look again and we're going to see how those capillaries, they kind of collect together into an interconnected network that's called a capillary bed. So we'll look at that in just a little bit. So the capillary bed, the blood from those capillary beds flow into the venules. And now we're into the veins. The venules are the smallest of all the veins. So they collect the blood from the capillary beds, and then that blood merges, those blood vessels merge into another vein, a larger vein that's called a medium-sized vein. So these medium-sized veins are about 2 to 9 millimeters in diameter. They have very few elastic fibers, but no need. By the time the blood flows all the way down to the capillaries, it's flowing through those capillaries very slowly. And the red blood cells that are in the capillaries are actually flowing single file. So the blood flow really slows down in the capillaries, and by the time we get to those medium-sized veins, they don't need a lot of elastic fibers because the pressure just isn't very high. We name the medium-sized veins too, so we'll hear veins like brachial vein and femoral vein. So the medium-sized veins are named just like the muscular arteries were named. Then these medium-sized veins are going to merge into the vena cava. So there's the inferior vena cava, and that's draining blood from the lower part of your body, the lower extremities, the abdominal pelvic area. And we also have the superior vena cava, and that's draining blood from your head and your neck and your chest and your upper extremities. So anything upper. All right, let's take a look at this other thing I want to mention. There is a condition that's called arteriosclerosis. Arteriosclerosis is a thickening and a toughening of the arterial walls, so of the arteries. You might hear it called the hardening of the arteries. And 1/2 of all deaths in the United States have been attributed to arteriosclerosis. This condition is also responsible for coronary artery disease. And what that means is that those coronary arteries are hardening. And so it's a very serious condition, and there's 2 forms of arteriosclerosis. One is called atherosclerosis, and atherosclerosis is more related to fatty deposits in the tunica media, and then there's also a corresponding damage to the endothelial walls. So some of this might be genetic, but a lot of this we attribute to diet and lack of exercise. And then we also have another form called focal calcification, and this is where a person has calcium deposits that follow any type of smooth muscle degeneration in the tunica media. So this sounds more like it's age-related and it's less related to diet and exercise, but it can also be associated with atherosclerosis. So a lot of times a person will have both of those going on at the same time. Now, there are actually 3 different types of capillaries that I want to mention, and so I want to go over each one of those. There are the continuous capillaries, and continuous capillaries are found in most tissues of your body. Okay, they're not found in cartilage and they're not found in epithelia, but in all other tissues of the body you find them. So when we look at a continuous capillary, we see that surrounding this small blood vessel is a simple squamous cell. And most of the time, these simple squamous cells can wrap themselves all the way around this blood vessel. So it's just a normal blood vessel with 1 layer of simple squamous cells. And so as the blood is being pushed through it, it will be pushed against the wall of the capillary, and certain things like water and small solutes and lipid-soluble molecules will be able to come through those cells, through the phospholipid layer of those simple squamous cells. And then we have these fenestrated capillaries, and fenestrated capillaries look just like the continuous capillaries, except they have these little pores that we call windows. So there's all these little windows in these cells in addition to any other channels that they might have. And so the windows allow for a more rapid exchange. Now, we find these types of capillaries in areas like endocrine organs, so the hypothalamus and the pituitary, where we need to get a rapid exchange. We need hormones to get out of those blood vessels or into those blood vessels as quickly as possible. And they're also found in absorptive areas of the GI tract. When you eat your nutrients, the nutrients have to get into those blood vessels as fast as possible, and so they can go through those fenestrated capillaries that have these windows. Then finally we have these sinusoids, and there's not as many sinusoids in the body as there are continuous or fenestrated, but these sinusoid capillaries are found in areas like in your liver. So these look a lot like the fenestrated capillaries. They have those little windows, those little pores in there, but they also, in addition to that, they have these huge gaps in between those endothelial cells. So they're big gaps, so bigger things now can enter and leave that blood vessel. For example, plasma proteins. Now, most of the time, plasma proteins stay in the blood and they can't get out. But in the liver, the liver makes plasma proteins. So we need to somehow get those plasma proteins from the liver cells into the blood, because that's where plasma proteins are supposed to be. They're supposed to be in the blood. So as the liver makes those plasma proteins, the cells of the liver, which are called hepatocytes, they will release those plasma proteins, and then the plasma proteins can enter into the blood through those gaps, which are called sinusoidal gaps in the sinusoidal capillaries. So then here's what a capillary bed looks like. Like I said, we usually don't have one capillary going from an artery to a vein. That's just not very common. Instead, we have what we call these capillary beds, right? And so in this capillary bed, which is an interconnected network of these capillaries, we'll see that a single arteriole, and that's what this is an arteriole, it can give rise to a dozen different capillaries. So you might find a dozen capillaries in a capillary bed, and then they are going to collect together into several venules. So you might have one arteriole with a capillary bed that will flow into several venules. Now, we're going to learn more in advanced A&P, so I just want you to realize here that we have kind of two ends of these capillaries. On the one end, which is closest to the arteriole, we call that the arteriole end. And so there's going to be different pressures. You've got these arterioles, which are really pushing fluid through. That's going to have a different pressure than at the other end, which is closer to the venule, and we call that the venous end. And by this time, the pressure is much less at the venous end. And this really comes into play when we talk about the exchange that occurs in capillaries. We're also going to take a look at valves, because veins have valves in medium-sized veins. So these valves are in medium-sized veins. And these valves prevent backflow. So when blood is moving in veins, it's moving back towards the heart. So if this were like a leg vein, the blood is supposed to be moving up towards the heart, and it's actually having to push itself past the gravity and past the friction against the vessel walls, and so the pressure is pretty low. And so in between heartbeats, when that heart stops beating, the blood wants to flow back. And so these valves then, they close. These valves close like this, and they don't allow any blood to flow past the valve. That prevents blood from pooling in your ankles. But when blood is moving forward, the valves open so that blood can move back towards your heart. Okay, so let's look at the distribution of blood. Where is blood found in your body? So if we want to look at a graph here, the venous system contains about 65 to 70%. So this is the venous system. Then at any given time, the heart and the arteries and the capillaries, they will contain about 30 to 35% of the blood volume. And then again, when we're looking at the veins, because that's 65 to 70%, at rest, 1/3 of this is in the liver, the bone marrow, and the skin. So we can say, because they are holding, a lot of blood, these things are blood reservoirs. At rest, they're holding a lot of that blood. And then when you're not at rest, they can release that blood and put it out into circulation. All right, so now we're going to talk about some cardiovascular physiology. And so we're going to start by looking at the heart. And when the heart beats, it pushes blood out into the arteries. So this is the systemic artery, so this is the aorta. So it pushes blood out into the aorta, and then that pushes blood down into the arteries. And so the pressure in those arteries, or the arterial pressure, we term as your blood pressure. That's what we're measuring, is your blood pressure, the amount of pressure in your arteries. Then the blood flows into the capillaries. And into the capillaries, we have the arterial end of the capillaries, and then we have the venous end of the capillaries. And so there's a certain amount of pressure in those capillaries as the blood pushes against the walls of the capillaries. And we call that the capillary hydrostatic pressure. So the capillary hydrostatic pressure is going to be greater at the arterial end, and then by the time it gets down to the venous end, it decreases a little bit, and so it'll be less at the venous end of the capillary. And then from there, the blood is going to move into the veins. And so there's a lot less venous pressure in the veins, and so the blood flow will be a lot slower once the blood gets into the into the veins. So when we look at these pressures, if cardiac output goes up, and cardiac output is stroke volume times heart rate. So if you have increased cardiac output, that means you have increased blood flow. On the other hand, if you would have decreased cardiac output, that means you would have decreased blood flow. Pressure and resistance affect the flow rates of blood through the capillaries. So we have to look at both pressure and resistance. So pressure is anything that is pushing the blood forward, and resistance is anything that is opposing that and trying to slow down that blood flow. In order for the blood to leave the heart and go through the arteries and go through the capillaries and then go back to the heart again, the pressure must overcome the resistance. So let's take a look at pressures and resistance. So first of all, the pressure in the arteries and the capillaries and the veins, that pressure comes from your heartbeat. So we call that pressure hydrostatic pressure. Hydro meaning the fluid. So that's the pressure from your heart. That's hydrostatic pressure, and that's going to push blood forward. So the hydrostatic pressure, which is the pressure generated by the contraction of the heart, pushes the blood through the vessels. We can say that blood is going to flow from an area of higher pressure to an area of lower pressure. So the higher pressure is going to be near the heart when the heart beats, and it's going to push that blood into those arteries where the pressure is not as high, and then into the capillaries where it's lower, and then into the veins where it's even lower. And of course that pressure, like I said, is going to be opposed by any force that creates resistance. So let's look at resistance first. So here actually is a drawing I can show you really quick of here. This is a blood vessel. So pressure is going to push blood forward. And then we have resistance, which is going to stop the forward movement. Okay, because it opposes the hydrostatic pressure. So there's three main things that create resistance. We have vascular resistance, blood viscosity, and turbulence. Let's first take a look at vascular resistance. So vascular here is telling us that this resistance is because of the blood vessels themselves. The blood vessels cause friction on the blood. There's two things that can cause this vascular resistance. One is because of the vessel length, and the second one is because of the vessel diameter. So let's take a look at the vessel length first. If you think about taking a ball and rolling it across your yard, eventually that ball is going to slow down and then it's going to stop. And the reason it does this is because it's coming into contact with the grass, with the earth, and that causes friction and that slows down the ball. Well, your blood has that same friction. It's going through your blood vessels and it's hitting the walls of the blood vessels, and that's going to cause that blood flow to slow down. Now, the longer the blood vessel is, the longer the blood is going to be in contact with that wall, and so the greater the resistance will be. It will slow down even more. Now, if you compared two blood vessels, and one was a certain length and the other one was twice as long, then the one that's twice as long will have 2 times the resistance as the one that is shorter. Okay, so there's 2 times the resistance. Think about if you try to blow water out of a garden hose. It's pretty impossible to do because the garden hose is so long, there's too much friction against the walls of that garden hose, and you're not going to be able to blow that water out. On the other hand, think about blowing water out of a snorkel. Now that's pretty easy to do because the length of that snorkel is pretty short, so there's not a ton of resistance that the water has against the walls. The other factor of vascular resistance is vessel diameter. And vessel diameter causes a greater impact on resistance than vessel length does. First of all, you really are unable to change the length of your vessels, so it pretty much is what it is. If you gain weight, your vessels will become a little longer, but other than that, your vessel length is pretty much set. However, with vessel diameter, there are certain things that will decrease the vessel diameter, like atherosclerosis, right? If you have a blood vessel and you get some plaquing in there and it fills up half the space, well, now that really cut down on the lumen of that blood vessel, and it really made the diameter much smaller. So atherosclerosis can decrease the diameter. And vessel diameter actually is much more impactful on resistance, because if you decrease a blood vessel diameter in half, so if you make it 1/2 as big as it was originally, you will increase resistance 16 times. So vessel diameter has a much bigger impact on resistance than the vessel length does. Then we have blood viscosity. Blood viscosity, so viscosity means thickness of blood. Your whole blood is about 5 times more viscous or thicker than water. So the thicker the blood is, then the more resistance it will have. There's certain conditions that can either increase or decrease blood viscosity. For example, anemia. Certain anemias, you are not producing as much red blood cells. And so red blood cells are they make the blood thicker. So if you don't have as many red blood cells, it's going to decrease blood viscosity. If you decrease the thickness of the blood, or if you decrease the blood viscosity, then you're also going to decrease resistance. On the other hand, another disorder is polycythemia, which is an increase in blood cells. then you will increase blood viscosity, making the blood thicker because there's more cells in there. And if the blood viscosity is increased, then you will increase resistance. I should go back and just clarify up here. I want you to understand that if you decrease the blood vessel diameter, then you increase resistance. If we want to write it out this way, right? So I just wanted to point that out. Now, going to turbulence then. Turbulence is the third factor. Turbulence is when the blood is flowing. Normally it should be flowing through a blood vessel, but if it hits something, it'll have these ebbs and swirls, and we call that turbulence. So that, of course, turbulence will increase resistance. It's a way to slow down blood flow. And we normally see turbulence in the large arteries, like in the elastic arteries, the aorta and the pulmonary trunk, because the heart is beating and that blood is pushing out so fast. Of course, there's going to be some ebbs and flows with that, and so that's turbulence. We also see it normally in the heart chambers. That's normal. But if we see turbulence in areas where we should not be seeing turbulence, we call that abnormal turbulence. And that can be caused by things like atherosclerotic plaquing. For instance, if you have an artery and you have some plaquing on the side, as the blood comes up to the plaquing, it hits that and it swirls around. That's turbulence, and that will increase resistance. So remember, all of these resistance things, all of those, the pressure of the blood moving forward has to be greater than the resistance in order for blood to move forward. That pressure has to be great enough to overcome anything that is trying to stop it. Anything, any resistance. So let's look at some cardiovascular pressures. Now, when the heart beats and blood moves out into the aorta, the blood pressure at the aorta is going to be about 120 millimeters of mercury. And then the blood meets all this resistance. It meets the length, it meets the walls of the blood vessels, it meets the diameter of the blood vessels, it has to deal with the viscosity of the blood and the turbulence of the blood, and so the blood pressure becomes much lower. And by the time the blood comes all the way back up to the vena cava, the blood pressure is now 2 millimeters of mercury. So there's quite a bit of difference between when it first exits the heart and then when it comes all the way back to the right side of the heart. By the time the blood gets to the capillaries, the blood pressure will drop to about 35 millimeters of mercury at the arterial end of the capillary, and then it slows down even more, and by the time it gets to the venous end of the capillaries, it's at about 18 millimeters of mercury. When we measure blood pressure, we measure the systolic pressure over the diastolic pressure. The systolic pressure is the peak pressure during ventricular systole. So this is the peak pressure when the ventricles contract. And we will measure this with an instrument called a sphygmomanometer. Okay, so that's a blood pressure cuff. And that's how we measure blood pressure. And so when the heart is beating and the ventricles contract, at the peak of that contraction, the sphygmomanometer will measure that, and we call that the systolic pressure. Then when the ventricle relaxes, which is during ventricular diastole, at the minimum pressure at the very end of ventricular diastole, we measure that again, and that is your diastolic pressure. So we take these two pressures and we put the systolic pressure over the diastolic pressure, and that gives us a reading for your blood pressure. So for instance, if your blood pressure, if your systolic pressure is 120 and your diastolic pressure is 80, we would say you have a blood pressure of 120 over 80. Or if your systolic pressure is 110 and your diastolic pressure is 75, we say you have a blood pressure of 110 over 75. Right now I just want to talk a little bit about capillary exchange. Right, so here's our capillaries. So on this side over here we have an arteriole, and the arteriole turns into the capillary. So this would be the arterial end of the capillary. And then the arterial end of the capillary leads into the venous end of the capillary. And then the venous end leads into the venule. Right, so we're going to look at some pressures in here and look at some exchange that occurs during this length of this capillary. So blood pressure is moving the blood through the arteriole and into the capillary. Then that pressure pushes the fluid up against the walls of the capillary and will force solutes and water out of the plasma through those capillary walls. Right, so we're going to see water getting pushed against the wall of the capillary and forced out into the interstitial fluid, and then some other things like small solutes and ions are going to pass through those capillary walls as well. Now, most of this water is going to be reclaimed again by the capillaries, so it will be reabsorbed. Actually, 85% of it is going to be reabsorbed back into the capillary. But a small amount of it won't be reabsorbed, and that amount of water will move into our lymphatic system, which we're going to talk more about when we get to chapter 22. So 15% of the water moves into the lymphatic system, and the other 85% moves back into the capillary. So the capillary reclaims the water that it filtered out. And that is what we call that. When the hydrostatic pressure pushes the fluid up against the wall of the capillary, we call that filtration. And then when the water moves back into the capillary, we call that reabsorption. So there's also some other movements of things across the capillary wall that don't occur because of this hydrostatic pressure. One thing is called diffusion. So diffusion, like we talked about early on in the semester, is the net movement of ions and molecules from a high concentration to a low concentration. So we will see diffusion. For example, we're going to see ions. Certain ions will diffuse across. So ions can diffuse across, and they go from high to low. Nutrients will diffuse across. They're going to go from high to low concentrations. So that's diffusion. Water will be reabsorbed through osmosis. So we know that osmosis is the movement of water from high water concentration to low water concentration. And I had told you that 85% of the water that was pushed out into the interstitial fluid will be reabsorbed. Well, the reason why this osmosis is occurring is because in the blood plasma, inside the blood vessel, in the plasma, are these large proteins. And these proteins act as a solute, and they're going to pull the water back in. So the pressure that these plasma proteins exert is called blood colloid osmotic pressure. It creates the conditions so that water will flow from an area of low solute to an area of high solute. So in other words, there's no plasma proteins out in the interstitial fluid, but we've got lots of plasma proteins inside the blood, so water is going to flow towards those plasma proteins. And then lastly for this chapter, I want to talk about venous pressure and venous return. So venous return is how blood is going to move through the veins back to the heart. The blood pressure in the veins is pretty low. As I already told you, by the time you get back to the aorta, the blood pressure has dropped to 2 millimeters of mercury. right? So blood pressure is really dropping, so there's not a whole lot of pressure trying to push that blood back up towards the heart. So there has to be some other factors that are going to bring that blood back up to the heart. And there are three factors. The first factor is that you have muscular compressions. What this means is that your skeletal muscles are contracting, and as they're contracting, they are squeezing and pushing on these veins and forcing the blood back towards your heart. So skeletal muscle compressions are very important in venous return and bringing the blood back to your heart. So in our patients that are more sedentary and they're not getting up and moving around, they have fewer muscular contractions. They're going to have less of this muscular compressions to bring the blood back to the heart. The second thing is what we call the respiratory pump. So when you are breathing, every time you breathe in, your thoracic cavity expands. So here's your thoracic cavity, the size of it when you are not breathing. And then when you breathe in, your thoracic cavity gets much bigger and air gets sucked up towards where you have this lower pressure. Because if you have more space, you have lower pressure. And we know that blood wants to move from higher pressure out in your limbs towards your chest where you have lower pressure. And that pressure is going to be lower when you breathe in. So we call this the respiratory pump. Every time you breathe in, you're basically sucking that blood back up towards that thoracic cavity because blood wants to move towards the lower pressure. In other words, inhalation decreases the pressure in your thoracic cavity and assists the return of the blood to the vena cava and then into the right atrium. And then the last factor that we have, we've already talked about, and that is the valves in your veins. And while they don't assist in bringing the blood back to the heart, they definitely prevent the blood from flowing backwards. So in a way, they are helping to assist bringing the blood back to the heart. All right, so that's the end of this lecture segment on Chapter 21, the blood vessels. In the next video, I'm going to go over the medium-sized arteries and veins and the elastic artery and veins, the names and the locations of those arteries and veins that you need to know for your lab exam.